Welcome to a Business Minute with Lily Lopez, presented by the South Florida Hispanic Chamber of Commerce, our weekly digital show. Today, we are honored because we have two outstanding women of our community. Giselle Cushing, Market President for South Florida and the Caribbean for Cigna. She brings 27 years of experience in group insurance sales, account management, and operations in the health and well-being industry. She's recognized as a thought leader who has proudly worked for Humana for 11 years. Her strategic focus and drive have contributed to her proven track record with strong market membership growth and financial performance. Her team ranked as a top commercial office for Humana in 2018 and has qualified for the company's president council 6 consecutive years. And now she's the market president for South Florida Caribbean. Oh, Caribbean too, I love it. For Cigna. So Giselle, thank you so much and welcome. And with her, God, we're honored. And look at these two beautiful ladies. We have Dr. Doris Muños-Mantilla. She's the medical director at Cigna Medicare. She's an experienced family physician with progressive leadership experience in a variety of primary care and employer-based settings. She's passionate about the delivery of high-quality, patient-centered care. A graduate from Emory University Family Medicine Program and the School of Medicine at the Pontificia Javeriana Universidad de Colombia. I love that. Dr. Muñoz-Mantilla has over 15 years of clinical practice as a board-certified family physician. She has held multiple leadership positions in organizations, including Cigna, the Obesity Medicine Association, and Emory University. So a very, very warm welcome to both of you, Dr. Muñoz-Mantilla and Giselle. Thank you for being on a Business Minute with Lily Lopez. So I'm going to start with a question for Giselle. So Giselle, what is the key message our listeners need to share with their employees as we continue to deal with this COVID-19 crisis, which I wanted to go away?
Lily, thank you so much for having me here today. You and I go back so many years, and it's always great to be here. I just wanted to say to all of you, thanks for having me here today. I'm really excited about this topic. So, really important, one of the things that we are seeing as a trend is really employees skipping their annual checkup and screenings. That's a concern. As we all know, being preventative, being on top of your screenings is critical to ensure that your health and well-being is, being monitored. Mm-hmm. We also see that, healthier employers are more productive with less absenteeism. Right. During the virus, a lot of people skip their checkups while women visits, mammograms, and other, health screenings, which lead to later detection and poor health outcomes. It's really important to catch these treatable conditions early. So what we encourage everyone to do is, to take advantage of your benefits that you have and see your doctor. Doctors are open. There's a lot of different options. There's, a great example is my primary care physician. He is doing virtual visits, and actually he's also scheduling in-person visits. I've gone ahead, and it's not just for medical, but dental as well. It's really important for folks to continue with those preventative screenings. But I'd like Dr. Muñoz to really expand on that, because as a physician, she's really involved in seeing what's happening, not just to the seniors, but to what's going on in our community at large. So Dr. Muñoz?
Sure, yeah. Thank you, Lily, for the opportunity to bring this message to your viewers. Let's remember that the 2 leading causes of death in adults in U.S. are heart disease and cancer. So it's very important to keep up with your annual checkup visits. In those visits, those are the opportunities for us doctors to order appropriate age screening tests that can discover early stages of diabetes, hypertension, high cholesterol. All of those are high risk factors for heart disease. The same goes for cancer screening as mammogram, colonoscopies, your skin cancer examinations, your pap smear. Let's make sure that we keep up with those visits.
I certainly agree with you on that. And I've interviewed in this show many doctors, and they say the same thing that you're saying, doctor. That people sometimes they're scared because of COVID, and they don't go to the hospital or they don't seek medical treatment on a timely manner. So they are seeing patients that are 30 or 40% worse off than they would have been had they gone when they had the first symptoms or whatever, that chest pains or whatever it is that they were having. But I also noticed one thing on my end, as a regular citizen, that also doctors are taking a longer time in giving appointments to patients because of COVID. So, for example, if you want to have you see your primary care, I know they'd rather you do the telemedicine, but I sometimes like the one-on-one. I like to be, I want them to touch me. I want to get my blood pressure.
Yeah.
And for whatever reason, because of the COVID, now the appointments, like what would be maybe next week or in 2 weeks, it'll be a month or a month and a half. So even laboratories, lab work, you used to be able to walk in or make an appointment. Now the appointment that they would have given you for maybe next week, it's next month. So this COVID has really, so it's a combination, right, of both the patient's responsibility that sometimes they're not doing what they have to do, but sometimes the doctors and these healthcare facilities are taking a little bit more time in doing what they have to do. So, I'm worried about that because I've seen a lot of people that have told me, wow, I needed an appointment. I need to see the doctor. They haven't returned my call. The appointment is like in a month or 2 months from now. And what am I going to do in the meantime? And just telemedicine is not going to make it for me. So those are questions that I think are still being out there that should be addressed, I guess. Yeah, probably by the administrators in hospitals, right? And medical offices, because a lot of people complain to me, say, wow, Lily, now the doctor's taking more than ever to see me. So, yeah.
Yeah, that's a small price. We're in the middle of pandemic. We weren't ready for this. So yeah, we're working with administrators, with the hospital, with the providers, and with the patients to make sure that we can make the best of the situation. But definitely, screening test is a priority for us. So let's, keep trying. If maybe, you cannot do it in 2 weeks, okay, we can wait for a month. That's okay as long as you put it on your calendar.
Exactly. And no, but Cigna, I know you deal with the senior citizens. I know that they're the best protected. They do when you guys do the greatest job. But I was referring to in general, not the senior citizens, but in general, the population. It's a combination. You have the people that are scared. You have the appointments that take long, and then they cancel your appointment. So this pandemic has really just turned everything upside down. But anyway, the important message that you're giving, and I agree 100%, is just take care of yourself, reach out to your doctor, and just move on taking care of and taking all your precautions. So doctor, the vaccine. Tell me about the vaccine. Is it essential to protect yourself and the community? Some people are scared because they say that it's the first time that this is a new vaccine that hasn't been tried on animals or on it's just really very scary for some people. So let us know your thoughts, your professional opinion about the vaccine.
Yes. So let's talk science. Let's rely on science. So the data from the CDC, which is the Centers for Disease Control and Prevention, says that when we compare Hispanics with other ethnicities, listen to this, Hispanics are twice more likely to get infected of COVID-19. They are 4 times more likely to get admitted to the hospital for COVID-19. And sadly, they're 3 times more likely to die from complications from COVID-19.
Why is that? Why is that? I'm sorry to interrupt because this is very extremely interesting.
Yes, and this goes with, every ethnicity has different comorbidities and risk factors. That's something that we're all born with. But Hispanic, unfortunately, because of the disparity of health, we have been affected for more chronic conditions. We have more diabetes. We have more obesity. We have more high cholesterol. We have less, self-care, less healthy diets. All of that will put us at high risk of developing a COVID-19 infection and to get complicated with it. So when we talk about the vaccine will save lives. The vaccine will only not prevent yourself to get the COVID. It will prevent the loved ones to get the COVID as well. So although it's normal to have questions, to be concerned about, these new vaccines, let's remember that it's not a new technology. This technology has been in place for decades now. So our message from Cigna is that we want to educate and encourage our Hispanic population to get vaccinated, especially those that are at high risk, more than 65 years old, chronic medical condition, those that are in healthcare personnel, all of those needs to get vaccinated. When you have the opportunity, take the vaccine.
Absolutely. And I agree with you 100%. I serve on a board that deals with health disparities. And according to, socioeconomic status, where you live and all of that affects tremendously. So definitely that's a nice message that you're sending to the members that are Hispanic at risk because of the obesity and the diabetes factor. So thank you so much for bringing that to the table. That was very, very good. So Giselle, what impact are we seeing on people's mental health? Because I know that's a problem. And how it's addressing that. I know that's a problem.
It's a huge problem, Lily. I think no one has escaped this. I think that if you sit in a room and everyone is vulnerable and really wants to speak out, what you're going to hear is that every person has been impacted one way or another when it comes to mental health during the pandemic. And it needs to be a priority. I would say that, just speaking for myself here, as a Hispanic, I'm used to high touch, talking to people, hugging, being around my family.
Exactly.
And it really, truly has impacted me personally. Yes. And so during these stressful times, it's really essential to make mental health a priority. And what are some ways you can do that, right? By being more high touch, contacting your family,
yes,
Zoom. There's so many different ways. And when you think of the senior population that's at home looking at TV, listening to the radio, there's a lot of chaos, uncertainty that's going on in the world that really brings out even more that physical and emotional stress.
Yes.
And so I think it's really important to do several things. One is, to talk to people, seek help, right? So a lot of the providers now are also virtual, which is great, because if you think about a year ago, 2 years ago, most of these appointments, you had to set up an appointment, you had to leave your work or your home to actually do this. And for a lot of people, that's personal. They didn't want to talk about it. So during the pandemic, now that we have, virtual behavioral health, it's fantastic. Just to give you a statistic that's really important, this is something that really has stood out to me, is that today, 1 out of 4 Americans are suffering from depression. That's a huge number.
Huge.
Right? So there's been a stigmatization around mental health. And, we need to destigmatize mental health, because it happens to all of us, right?
Absolutely. Yes, I agree with you. Absolutely. And Dr. Munoz, many of us are part of that sandwich generation, caring for children, aging relatives. And Giselle knows I used to bring my father to the event. So people was popular in the Chamber of Commerce, and he would come with his hat, and everybody loved him. But we're like that. Hispanics are like that. So what advice do you have for us? Because people are taking care, have children, grandchildren, then they have the parents. It's difficult to balance quickly.
Exactly. But that's us. We are highly caring. So we have multi-generational households. We have the kids, we have the mom and the dad, and then we have the grandparents. So what is important there is talk about the prevention. This is important. Let's keep up wearing our face masks. Let's wash our hands frequently. Let's keep distance, if we are outside. Also, let's make sure that we keep connected, as we were saying, with mental health. Let's make sure that we keep doing the behaviors and the activities that make us healthy diet, physical activity, go outside, connect, talk to people, be creative. We're creative, go outside in the gallery, in your garage, do, like a little gathering, everybody 6 feet apart, wear your mask, and have a great time. That's important. We cannot separate mental health from health. It's a component. It's a combination. If one goes down, the other one is gonna be down too. So let's make sure that we protect each other, and then again, let's get vaccinated so we can protect our whole household.
Yes, absolutely. And Giselle, how Cigna working to help improve health, not just for your clients, but also for the greater Hispanic community of South Florida? Because I know that's so important. I mean, being that it's 69% of the population.
Yeah, so we're doing several things. Back in November and December, we actually launched what we call Cygnus Safe campaign. Right. And we brought what we call Health Improvement Tour Bus. So it was a big bus that came to Miami, and we provided free flu shots and PPE. Right. And we also partnered with Jason Taylor to help us, spread the word. During the pandemic, we've seen a high rise with food insecurity, right, and the challenge that has to our community. Right. So we've supported different areas such as Miami-Dade College Food Pantry. So we provided students who are hungry that couldn't achieve their education goals. We also supported Meals on Wheels, which fed about 10,000 seniors and 24,000 children. And we're looking to expand a grant that we have right now, which is called Cygnus Healthier Kids for Our Future food program in South Florida. So there's a lot of different things, and education, right? So things like this, getting out there and spreading the word that it's important. Diversity when it comes to Hispanic and African Americans, we've seen a higher incidence of health disparity as well as COVID. So I think it's really important to continue to spread that word, and Dr. Munoz and I, as well as the Cigna enterprise, is committed to that. So I think there's more coming, and so I can't wait to continue to have this discussion and be very in front of the community around this and just supporting one another.
And I love that initiative. You know that we're doing, for Mother's Day, we're doing a food drive with distributing a lot of food to the financially disadvantaged families of Centro Mate. Because you are always a great supporter of the toy drive that we do. So now we're expanding it, and for Mother's Day, we're going to do on Thursday, we'll drive through and delivering food for all of them, because you know that those families, their median income is less than $25,000. So to your point, yes, there is a lot of need, and it's great. And I congratulate you, Giselle, for your leadership, and the entire Cigna team for doing what you're doing, because you're really out there and in charge of just taking care of the community, not only your members, the people that are part of Cigna, but the whole community. And that's what it's all about. Not only your members, everybody. And that's what we do here in the chamber. Not only members, we help everybody that needs us, because that's the way to go. So ladies, it's been such a pleasure having you today on A Business Minute with Lily Lopez. I thank you so very much for your valuable time. And I know that everybody's going to enjoy this show very, very much. And now I'm going to send this over to Yendi Alvarez for 90 seconds of tech.
Thank you.
Thank you.